Good evening, everyone. My name is Michelle Fletcher, and I am the recruiter for Central Virginia Community College. Thank you all for tuning into this session this evening. Now, before we get started, I need you to know that this session is recorded, and we will upload this session to our YouTube channel as well as to our website. So you would have the opportunity to go and listen again at your convenience to our website. And I would encourage you to go out and take a listen for some of the sessions we've already done and take a look at the upcoming sessions as well. So that again, you can be informed as to what we've already discussed and some of the sessions that we'll be talking about as we move forward in the future. It is our effort to make sure that we bring you all the information that you need so that you can make an informed decision about CVCC. Now, that said, our guest speaker tonight is Ms. Lori Slayton, CVCC's Director of Medical Laboratory Technology. Ms. Slayton will be talking with us again about the medical laboratory program, as well as hopefully some career opportunities that you can pursue in this field of study. Feel free to ask us questions along the way and use your reaction button to engage with us. Yes, we do want to hear your questions. So we will be paying attention to those questions as they pop up, and we will get those questions asked. So again, you can get the information that you need. We will also leave a few minutes in the end for Q&A. But again, feel free to ask questions as we go along. All right, we are ready to get started. I'm going to give it over to Lori, and she is going to take it from here. Lori?
Hello, future MLT students. I'm Lori Slayton. I'm the program director for the MLT program. It's a program that's ran between CVCC and Centra. And a lot of people are unfamiliar with what medical laboratory technicians and scientists do. So I'm going to be talking a lot about that and hopefully answer all of your questions today. So I'm here with Miss Jones, who is an instructor in the program. She's faculty at CVCC. She teaches half of the class or over half of the classes in the second year, and I teach clinical chemistry and hematology as part of the program in the second year. So what is an MLT? An MLT, we work in the lab behind the scenes. We do all the testing in the clinical laboratory. So what Ms. Jones and I do is teach our students the theory and the hands-on skills that are necessary to perform a large variety of the laboratory tests. So graduates from our program are certified to do testing in all areas of the clinical laboratory. The main areas are blood bank, hematology, chemistry, and microbiology. So those are the four main departments that are in almost every hospital laboratory. And then there's other departments as well, depending on which hospital. But those are the four main ones, and our graduates are certified to work in all areas. So for example, some of the types of testing that you might do when you graduate from this program would be to identify leukemic cells in a blood smear to aid in the diagnosis of cancer. Our graduates quantitate glucose in a blood sample to monitor a diabetic patient's glycemic control. They culture wounds to identify the bacteria that's causing an infection and determine antibiotics needed to treat that infection. And they also test donor blood units to find a compatible match for patients who need a transfusion. So that's just some examples of the testing in each of those four departments I mentioned. And there's just so much variety of the different things that we do. And we really don't see patients much of the time. we work behind the scenes, like I said. This profession is kind of hidden, and most people don't know that it's a career choice that you can have, but once you find out about it, you'll see that it's really awesome. It's kind of like being in a secret club working in the lab. It's a place where patients don't go, and we pretty much work by ourselves and send the report to the doctors after we finish our testing. According to the CDC in 2018, they said that approximately 70% of medical decisions rely on laboratory testing. So even though the work that we do is behind the scenes, our graduates have a very crucial role in the care that is provided to patients on the front line and by the healthcare team on the front lines. So knowing all this, Debbie and I have a big responsibility as instructors in this program to prepare our graduates well to be able to report accurate tests, and the work that you will do is going to be incredibly rewarding throughout your career, as it has been for me. So this program is a 2-year program. The first year are prerequisites. So some people are confused that it's 2 years after the prerequisites, but the prerequisites are the first year. Once the prerequisites are completed, there's only 1 more year after that. So the prerequisites for this program include a lot of the same prerequisites that the other healthcare professions do. English, biology, a lot of the main things. There's 2 chemistry classes, a microbiology and anatomy and physiology. That's also very helpful. So once all of the prerequisites are finished, you would be able to start the second year of the program, which is the medical lab classes, and that's 1 year. So you'll get a degree from CVCC, an associate's degree, but during the second year, you're also a student at Centra as well as CVCC. So as a student for Centra, there's different things that you have to do from CVCC. But we have all of the labs for the program at Virginia Baptist Hospital. So those are on Tuesdays and Thursdays all day from 8 a.m. to 4:30. And then Monday, Wednesday, and Friday, you'll be at CVCC for lecture. Usually those end by noon or earlier on Monday, Wednesday, and Friday. So the second year, you graduate in May, early May, and immediately after graduation, you are finished. You've finished as a student at CVCC and you'll have your degree, but you're still a student at Centra at that point, and you'll start the clinical rotations, which lasts about 11 weeks, where you'll be in the clinical laboratory full-time, completing rotations in each of the 4 departments. So once you have graduated and you've finished the clinical rotation, then you're eligible to sit for the Board of Certification exam. And once you pass that, and you'll be certified as a MLT, and you can get a job pretty much at any hospital in the country. The field is in really high demand. It has been the entire 16 years that I've been in this field. So you'll never have a problem finding a job pretty much anywhere. And Centra has hired all of our graduates from our program. They prefer our graduates as opposed to students that they get from anywhere else or other locations or people who are traveling techs who don't live here. So they really, really like our graduates. They say that they're more prepared than anyone else to when they start their career. So you'll easily be able to find a job when you graduate. So let's see. What else should I mention, Debbie? Yourself, Debbie?
Yes.
Okay.
Hi, I'm Debbie Jones, and as Lori said, I am the other instructor in the Medical Laboratory Technology program at CVCC that's co-sponsored by Centra. I am so fortunate to have actually graduated from this program, and it was quite a while ago, many years ago, that I graduated from this program. So I worked in the field for 37 years. When my predecessor, who used to teach, who I was so, who was my mentor, he retired, and then I applied for this job. So, um, as Lori says, you really should try to when you're in this program and when you graduate, you want to vary your experience and make sure that you cover all areas of the lab. That was one thing that I did not do. I concentrated my studies in microbiology, which, I have never had any regrets about that, but that does kind of limit your availability for other jobs. So it is a very exciting field to work in. I can tell you many stories of different clinical procedures that or clinical conditions that we have been essential for diagnosing, for the doctor to get the answers that he needs. Most of the time, of course, because of the lab work, the doctors are, usually have a clue as to what the diagnosis is, but there have been instances in which we have helped the doctor because they had no idea that the patient had that particular infection or that a particular condition. So we're, as she said, we are like a little club. We're a unique club. And we all get involved when we find something exciting like malaria or some fungal disease or something that's rare. We all call everybody in to look at the microscope so that we can see these organisms or these cells that we don't routinely see. But the majority of our work is the routine work, and it doesn't really get mundane or boring because that there's the chance that it might not be. It may be something abnormal, and we like to be able to focus on those and to show those to um, new employees or to students. So we all get together and we rally around, and when you go through your clinical rotations, the family of technicians and technologists at Centra, they are in your corner, rooting you on, want you to do well. They want you to succeed. So they will make sure that you get the training that you need to be a professional and to be, to be very competent and very good at what you do.
Thanks, Miss Jones. That was a lot of great information. Let me answer some frequently asked questions that I get. I get a lot of, we have a lot of students who already have a bachelor's degree in things like biology or chemistry. So we have a lot of students, they sometimes can't find a job in that field and find out about being an MLT and go through our program to get certified. And then they can, with a year of experience working as a certified MLT, since our program is accredited by NACLS, they're eligible to challenge the board exam, having a bachelor's degree, and get the higher certification as a medical laboratory scientist, which goes along with higher pay. So there's a lot of things that you can go into by starting with the MLT. Of course, it's better to start as an MLT because then you can start working in the field after just 2 years. But there's also other ways to go about it. That's a question that I get a lot. What other questions do you get asked, Debbie?
I have had people ask me how easy it is to, I think when people come into our program, a lot of times they are kind of leery because they know that it's a lot of science, and they don't realize their own potential yet. And it is challenging, but we try to make it as as smooth sailing as possible. If you're having issues, we have an open door policy. You're always welcome to come into our offices and question us about the material. But the biggest question I think that most people have is, how hard is it? And so again, I think that most people, when they start the program, haven't been challenged to this degree, but they almost always at the end are appreciative of the fact that we kind of push them maybe, or encourage them, I guess is the best way to say it. And they do well, and then they oftentimes will go on to other healthcare careers because they now know that they have the ability to to do the work and to comprehend the scary science material.
Thank you. Yeah, that's a
Well,
great point.
No, go ahead.
We do try to work with all of our students as much as possible to make sure everyone can be successful in the program.
Well, there's
Um,
one question out here. Someone came in, she said a little late, and that's okay. Thank you for joining us. She would like to hear, how long is the program?
It's a 2 years. The first year is prerequisites, so it's a little misleading maybe. It sounds like it's 2 years after the prerequisites, but no, the first year is the prerequisites. So once those are finished, it's only 1 year after that. And you'll
And two,
get an associate's degree in applied science from CVCC. And following graduation, there's an 11-week internship with Centra. And then once you finish the degree and the clinical rotations, then you're eligible to sit for the certification exam.
well, I'm curious. I have a question for you and Debbie. What what drew you to the field? Was there someone in your family that was in this particular uh, field of work? What drew you to it?
That's a good question. I had no idea that this field existed, like most people. When I was, as long as I can remember, from at least when I was in 4th grade on, I always wanted to be a scientist. I had like a chemistry set that it was my favorite thing to play with, and like a little lab coat. And I always just wanted to be a scientist, but I thought I was gonna have to like get a PhD and do research or be something like a chemical engineer maybe. But those didn't really appeal to me. So then I was decided, well, maybe I'll try to go to medical school. And my counselor at college actually told me about the program and said that it was a great, even better than majoring in biology, it would be a great way to prepare for medical school. And that really is true. It's also a great program if you are wanting to become a physician assistant, because we cover lots of different states of diseases and how to interpret all the results. So it would be really helpful for something like that. But thanks for that question, because that is, it was not something that I always knew I could do. However, if I would have known when I was a kid, I definitely would have said I want to be a lab tech when I grow up.
Okay, what about you, Deb?
Okay, well, I was in high school, and I loved chemistry, I loved biology, and I was really close with my chemistry teacher. And he was the one that pointed me in the direction of CVCC. Um, I am the first generation in my household to get a degree of any kind. So he was very encouraging and knew that we didn't have the funds to go to a four-year college at the time. So CVCC was a wonderful avenue for me to get into the field, to work in the field, and then to get additional education, to teach this program. Also, I'd like to add to what Lori said about physician's assistant. We have at least two people that I know of that have graduated from our program who have become physician's assistants. There are some that are working in cytology. So this program opens the door for people to again realize their potential and to be able to work in other fields of healthcare.
Okay, well, thank you. Well, listen, we're going to open it up for a few minutes because we have just a few minutes left for Q&A. But before I say that, I just have to say that you guys shared a lot of good information, but it's kind of scary too, because the accuracy of what you all do, I mean, you've got to be on point in terms of being able to uh, know what you're looking at and passing that information on to the doctors so that they can have accurate information for diagnosing and that sort of thing. But I definitely appreciate all that you've shared. So what we'll do now for a few minutes is open it up for Q&A. And if anybody on the call would like to ask a question or throw a question into the chat, we'll be happy to take a look at it and entertain it. Any questions out there? The question is asked, what is the average salary?
The salary depends on a lot of different things, like the area you work and whether you're an MLT or MLS. Having the higher certification comes with higher pay. And it also depends, since most MLTs work in a hospital, there's, which is open 24/7. So there's weekend differential and evening and night shift differentials and holiday pay and things like bonus pay for taking a shift that's hard to fill. But entry level, from with no experience, starts around like 20 to 25 an hour for MLT, and that comes with, that's just the base salary. That is if you worked day shift without any of the extra shifts, which aren't included in that.
Now, is that salary, the salary here in Lynchburg, Central Virginia? That
Yes.
starting rate?
Yes, and if you go to bigger cities,
Right, that's where I'm
it
going.
comes with more pay.
I'd like to add also that once you pass a certification, and we encourage our students to take the certification as soon as they are eligible. If you get certified, there is an increase in pay. Also, most healthcare institutions now require that you become certified. But there are a few people still working that never did become certified. However, that's their choice. That wasn't because they didn't have the opportunity to get certified.
Any other questions out there? Anything else we can answer for you before we get off the call? All right. Well, listen, can we show these ladies some love because they did a great job? Use your reaction button and show some love. I thoroughly appreciate everything that you all have shared with us this evening. So I'm going to give just a few gentle reminders, and then we will go ahead and call it an evening. I would ask those on the call to mark your calendar for Tuesday, March the 26th. That will be our next information session, again, from 6 to 6:30. We will be highlighting CVCC's early childhood program. So if you're interested or know of anyone interested in this particular area, please join us on March the 26th. Remember to check out our website for dates and times for future sessions, and that the videos, again, they are posted to our YouTube channel and to the website. I would ask that you give me maybe about a week. Today is Tuesday, so between now and next Tuesday, this should be posted, and you can go and take a look and listen again at your convenience. Lori, Debbie, anything else before we get off the call?
No, but thank you everyone for joining, and I hope to see your applications for the MLT program coming my way soon.
Very good. Thank you, and have a good evening.
Thank you, Michelle.